Hello, this is Dr. Daulton Jr., and I want to welcome you to this video. And today we are going to be talking about a medication called Tramadol, and it's more commonly known as Ultram. And basically, this video is going to cover everything that you need to know about this medication. So we'll talk about how the medication works. We'll talk about any side effects that you can have from it, drug interactions, any interactions with nutritional supplements, and then we'll also at the end talk about some alternatives that you can use that are natural that will give you the same type of benefit as taking this medication in case you want to avoid some of the side effects that we'll be talking about in a little bit. So, first of all, let's talk about what Tramadol and Ultram is. And basically, this is a type of drug that is called a centrally acting synthetic analgesic. And what that means is that it's a pain reliever and it works at the level of the central nervous system, which is the brain and the spinal cord. And I'm going to show you an image in a little bit of how this actually works. But basically, it has a couple of functions. First of all, it's an opioid receptor agonist. And what that means is that it stimulates the neurons within your brain that are stimulated by norepinephrine. And what that does is it stops your nervous system from feeling pain. The other thing that it does is it induces serotonin release, which is another neurotransmitter, which is a chemical that's produced in your brain. And what that chemical does is it makes you feel happy or a little bit lighthearted, that sort of thing. And then the other thing it does is it inhibits the reuptake of norepinephrine. And what that means is that norepinephrine, and like I said, I'm going to show you a picture of this in just a minute, but norepinephrine is actually a neurotransmitter or a chemical in your brain. And what it does is when it's released, it actually will stop you from feeling pain. Well, what this medication will do is it allows that norepinephrine to stick around a lot longer, which gives you a longer lasting experience of pain relief, basically. So what it's doing is it's stopping your nervous system from feeling the pain so that you don't really know that it's there. The uses for Tramadol and Ultram is it's used for moderate to moderately severe pain, rheumatoid arthritis, restless leg syndrome, motor neuron disease, which basically stops your muscles from functioning normally, and fibromyalgia. Now, it's also experimentally being used for depression, anxiety, and phobias, but this isn't really commonly used. And in fact, a lot of doctors won't even recommend it for that because there isn't anything supporting that this would be a good medication for those types of conditions. Now let's talk about neurons and neurotransmitters for a minute and how they work, because this is really important for understanding how this medication will actually give you pain relief. Now, if you look at the picture here, what we're looking at brain cells, and the brain cells are called neurons. And the way that this works is that they look kind of funny here, but you can see that they've got these little almost like little fingers sticking out here. And what we've done is in the bottom pictures here is we've enlarged that so you can see what's happening here. Now these pictures here are actually right here. So you've got a neuron here and a neuron there, and then they're connecting, and this is what they look like if we look at it under a microscope and look at it a little bit larger. Now here's basically how your brain and nervous system works, okay? Your brain and nervous system are composed of these types of cells called neurons, and what they're doing is they're communicating. You have to understand that your nervous system controls every single thing within your body. There isn't a single thing that happens inside of you that isn't controlled by your nervous system, and the way that it's communicating to your body is through these neurons and through these different chemical reactions that are taking place within the brain and the nervous system. So let me just give you an example here. We're going to talk about pain for a second. Let's assume that you have rheumatoid arthritis, okay? Maybe that's the reason that you're taking this medication. Now, very commonly, rheumatoid arthritis will affect the hands and the fingers. And basically what this is, it's a type of arthritis, and it eats away at the joints, and it will produce an inflammatory effect. Now, what that means is that there's chemicals being released there that gives you pain. So here's what happens. The nerves that actually go out and talk to your finger joints, because there are certain chemicals that are released during the inflammatory process of rheumatoid arthritis, these nerves are going to pick up on those chemicals. And what they're going to do is they're going to send a message from the nerve that's attaching to the joint, and it's going to come up here and it's going to connect to another nerve that goes all the way up to your brain. And where they connect, there's going to be chemicals that are released here, and we call those chemicals neurotransmitters. Now, in the case of pain, the chemical that's usually released is something called substance P. Well, those chemicals are going to go out between the space, and they're going to attach to this neuron that goes up to your brain. And because that chemical is being released here, this neuron is going to send a message up to your brain saying, hey, my fingers hurt. And you have the experience of pain. All right. Now, the way that this drug works is it messes with these chemicals basically. So what it's doing is it's causing these nerves or these neurons, instead of releasing something like substance P that's going to give you pain, it's going to cause it to release serotonin, which is going to make you feel good, and norepinephrine, which is also going to stop the pain experience for you. So you feel better. Now, there's a question that you may be asking at this point, which is, okay, well, the problem is still there, correct? And that is true. And that's one of the major issues with taking a medication like this, is that you're really not correcting the problem. All you're doing is making your brain think that there's no pain there, when in reality, you still have an issue there that you really should be treating, okay? So I want you to just keep that in the back of your mind as far as how this medication is actually working, and the fact that all it's really doing is hiding the pain experience. It's not letting you have it, okay? So you feel better, but the problem is actually still there. Now, for the recommended dosages of this medication, I'm going to have an article that I'm going to give you a link to at the end of this video. And if you go to that link, what you'll see is that I'll have all of this written out for you, because this is just information that you can read. The main thing is this is a prescription medication, so you only want to take it as it's prescribed by your doctor and in the dosage that they recommend. But there's a few other helpful little tips here that I've included that you'll be able to read in that article after you finish watching this video. Now, some of the drug interactions of Tramadol and Ultram and some of the contraindications are these, and you'll see it's a pretty big list here. The first thing is you're more likely to have a seizure if you take it with MAO inhibitors, and these are medications that are used for depression, and I've got a list of some of the medication names there for you. You're more likely to have seizures if you take it with antidepressants as well. And that's actually one of the biggest concerns. They actually say that this medication is one of the largest causes of medication-induced seizures. So you want to be real careful with that. And if you start to notice any symptoms that are similar to that, you want to make sure that you talk to your doctor about that. You also don't want to mix it with cold or allergy medicine, sleeping pills, muscle relaxers, and medicine for seizures or anxiety, because what that will do is it will make you feel sleepy. And they say that another thing with this medication that's really important is that you do not, well, they say that you can drive, but you need to be aware of how you're feeling, because it can make you drowsy, and you want to be careful about driving if you're going to do that. Lithium, which is used for bipolar disorder, will interact with this. ADHD medications, antibiotics, antifungal medications, certain cancer medications will also interact with it. Heart medications, blood pressure medications, HIV and AIDS medications, migraine headache medications, alcohol. You really do not want to drink alcohol with this, and the reason is because it can slow down your breathing. And there have been certain cases where people have actually died in their sleep from this. So you do not want to mix alcohol with this medication. Warfarin, which is a blood thinner, and what it will do is it can actually cause internal bleeding if you take this with warfarin. Some nutritional supplements that it will interact with. It'll interact with St. John's wort, which is used for depression, quercetin, which is used for heart diseases, and 5-HTP, which is also used for depression. So you never want to mix those together. And then the final thing I'll say here is that this is not safe during pregnancy. Now, if you look at what what they would recommend about this, they'll tell you that there's no research indicating that it is not safe during pregnancy, but they still warn you that it's probably not safe, because what they found is that sometimes the baby can be born and they can actually have withdrawal symptoms from this medication, because one of the key factors about this is that it is addictive, simply because of the neurotransmitters that it's affecting in your brain. And actually, if you look at it, the neurotransmitters that this is affecting is the same as heroin. So that kind of gives you an idea about the fact that this can become addictive. And so there are some problems that can develop with the child if you take this during pregnancy. So the general advice is stay away from this medication if you're pregnant. Now, some of the side effects of Tramadol and Ultram. One of the most common is allergic reactions. So if you notice that you're getting hives, difficulty breathing, swelling of your face, lips, tongue, or throat, you want to talk to your doctor about that right away. It's also common that you can develop some psychological problems such as agitation, hallucinations, and depression is another common side effect. They actually say that one of the more serious side effects of this is a feeling that you want to commit suicide. So you do need to be very careful with this medication. It can also cause fever, fast heart rate, overactive reflexes, nausea, vomiting, diarrhea, loss of coordination, and fainting. Seizures, we already discussed. It can develop a red, blistering, peeling skin rash, shallow breathing or a weak pulse, dizziness, constipation or an upset stomach, headache, drowsiness, feeling nervous or anxious. Addiction is obvious, obviously an effect of this. It can also cause sexual dysfunction, including delayed ejaculation in men, internal bleeding, which is why it should not be taken with warfarin. And we talked about depression and suicide as well. So these are the most common side effects with this medication. Now, let's talk about some alternatives to Tramadol and Ultram, because I don't know about you, but that list of side effects actually sounds pretty scary to me personally. But what we want to understand is that when we're dealing with the types of conditions that you're using this medication to treat, typically what we're looking at is an inflammatory process. So if you're using this for rheumatoid arthritis or if you're having some type of pain, the majority of the time, the reason that you're experiencing that pain is because of what's called inflammation. And basically what inflammation is this. Whenever you have an injured or a damaged area, what's going to happen is that your body is going to send a lot of blood to that area because it needs to send nutrients and oxygen to it in order for it to heal properly. Well, the problem with this is if we send a lot of blood to the area, that area is going to swell up and it's going to get really hot to the touch because of the swelling and the blood that's flowing there, and it's going to cause you a lot more pain. And it doesn't matter, for example, some people use this for neurological conditions as well, so like we talked about with the motor dysfunction. A lot of these cases are related to inflammation, and so we want to look at that, and we actually want to treat the inflammation rather than trying to use this medication to just hide the fact that we're experiencing pain. Now, the way that we treat inflammation is this. The first thing I would recommend that you do is look at using either ice or heat. Now, this is really, really tricky because if you do the wrong thing here, you're actually going to make the pain worse. So there's a little test that I would have you do. In the majority of cases, when we're talking about pain, ice is going to help you more. However, because with Tramadol and Ultram, we're typically treating arthritic conditions a lot of times, in that case, ice is not good. So here's what I'm going to have you do to test it. Start with ice, and what I want you to do is I want you to use real ice. So you want to go ahead and get ice from your freezer, put it in a baggie, place a towel over the area that you're going to treat, and then put the ice on top of that. Leave it on for 15 minutes or until you feel numbness in the area, whichever one comes first, and then you're going to take it off for an hour and then repeat the treatment. Keep on doing that every single hour as often as you can during the day. And what I'm going to have you do here is do that 3 or 4 times at first and just see how you feel. If it feels better, then go ahead and stick with ice and stick to the regimen that I just gave to you. If it doesn't feel any better or if it feels worse, what I'll have you do is discontinue the ice completely and move to heat. Now, typically, dry heat is going to feel better. So if you just have an electric heating pad that you can find in any drugstore, that would be what you would want to use. And you want to follow the exact same rules. So you want to put it on for 15 minutes, take it off for an hour, and then repeat the heat treatment throughout the day. Typically, when I have patients who do this, what we find is that this is the fastest way to get relief, typically. And a lot of times if you're thinking in your head, well, I've done ice or heat before and it's never worked, probably the reason is because you haven't done it often enough, just like what I just described. So you really want to be consistent with it in order to get the best benefit from it. That is above and beyond one of the best things that I can tell you as far as trying to alleviate the inflammation that's actually causing your pain. So ice and heat is the first thing. And by the way, sometimes I realize that I do talk pretty quickly. So if you want that information written out, like I said, I'm going to be giving you a link to go to at the end of this video where you can have all of this written out. And if you look to the left of the video on that page that I'm going to send you to, you'll see that I have a free ebook that you can sign up for. And the free ebook is actually about spinal disc conditions, which is my specialty. However, the reason I would encourage you to sign up for it if you want the details about ice and heat is because I have all of that I just explained to you written out in detail so that you can follow along with it. And you can use ice and heat no matter what the condition is that you're treating if it's a painful condition, okay? Now, the next thing, and this is a really big one, is something called proteolytic enzymes. Now, these enzymes are different than what we usually think of with digestion, and basically what they are is they're enzymes that pass through your bloodstream and they go to the inflamed areas. And whenever you're having inflammation, what happens is that your body is releasing chemicals there. Well, the proteolytic enzyme is going to break down these chemicals and eliminate them from the body. So they're really, really helpful when you're dealing with a painful situation. There's one brand in particular that I strongly recommend. It's called Heal and Soothe. Now, you will not be able to find this at most health food stores. However, I'll have a link on the page that I send you to where you can find it and order it online if you're interested in that. And I also have some articles there that you can read more about it so you can see exactly what it's all about and what it does. But it's really, really helpful in these types of cases. The next thing is probiotics. Now, probiotics you can buy at a health food store, and what you want to do is you want to take 4 times the recommended amount on the bottle each day if you are experiencing pain. And that's also going to help to eliminate some of those chemicals that are being released. Vitamin D3, you want to take 20,000 international units per day. And this is something you can also find at a health food store, but the reason why you want to take it in that higher dosage is because at that dosage, vitamin D3 will actually act as a strong antioxidant. And when you have an inflammatory process happening in the body, one of the chemicals that's released are basically these bad chemicals that can cause problems such as cancer, heart disease, and that type of thing. What the vitamin D3 will do is it will help eliminate those, and you're going to feel better a lot more quickly. But you have to take it in a higher dosage like that in order to get that type of effect. Now, vitamin D3 is really good to also continue taking after the pain is alleviated, because if you continue to take it at that dosage, you'll prevent a lot of major health issues down the road, like what I just talked about with heart disease, cancer, and that sort of thing. So it's a really good thing to take on a regular basis, even after you're out of pain. Now, in a lot of cases, when you're taking this medication, or when you're considering taking this medication, you're looking at more of a chronic type of a problem. So we're looking at people who have chronic back pain, which means that it's lasted for a while, or maybe you have back pain that comes and goes. We're talking about long-term problems such as rheumatoid arthritis, fibromyalgia, these types of things. When you're dealing with a long-term problem like that, what you're typically looking at is chronic inflammation, and so we have to take a different approach, and here's the reason why. When you're dealing with a chronic long-term problem that's causing you pain, usually the problem isn't just because of an injury. Usually it's also because of your diet and what you're putting into your system. And believe it or not, this makes a huge, huge difference in how you feel if you're experiencing a chronic health condition. So if that's the case for you, then the first thing I would encourage you to do is to eliminate all sugar from your diet. And this is huge because sugar will actually stimulate the inflammatory process and make it worse. And if you do nothing else that I recommend in this video, that's the one thing that I would encourage you to start doing, is just eliminate the sugar from your diet as much as possible, and it will help you feel so much better. The next thing you want to do is eliminate white flour from your diet. So you want to avoid white breads, pastas, and that sort of thing. And a rule that I recommend to my patients is this: if you're reading a label on a food item in a grocery store, and if it has more than 6 grams of carbs, you don't want to eat it, okay? Because that's going to stimulate the inflammatory process within your body. The next thing is to increase your fruits and vegetables. Not only is this going to provide fiber in order to cleanse your system, but it's also going to provide a lot of good nutrients in order for you to heal more quickly. One of the ways that I do this, because for me personally, eating fruits and vegetables has always been a problem. I don't enjoy them most of the time. So what I did was I discovered this product. It's called the NutriBullet, and basically it's like a blender, but it has a special attachment to it that will blend the fruits and vegetables in a certain way that it brings out all of the nutrients so that they're more easily absorbed by your body. And so basically what you do is you make a little fruit and vegetable shake every day. And what I do is I put in mine spinach, apple, pear, pineapple, and banana. And you basically just put that in there, put some water in it, and then blend it all up. And you drink that. And what that's designed to do is to cleanse your body. Now, if you're in a lot of pain, or if you're having a health condition that you believe is due to chronic inflammation, you also want to add 1 inch of fresh ginger root to that, because that's a natural anti-inflammatory and it will help out quite a bit with the pain. I do this once a day because I'm a very healthy person. However, If you're experiencing pain or if you think that you're dealing with a chronic problem that's related to inflammation, do that twice a day. So you want to make one drink in the morning, one drink in the evening, and then eat normally during the day otherwise. But if you do that twice a day, you're really going to get the effect a lot more quickly as far as getting the nutrients from those fruits and vegetables into your system and cleaning out all of the debris and all the, bad stuff that comes from the inflammatory process. Now, if you found all of this information useful and you'd like to see everything that I have written out for you in the article, this is the website that you want to go to. It's healyourbulgingdisc.com/tramadol-ultram.html. And if you're watching this video on YouTube, if you look directly below this video, there's a description box there, and I have that link in there that you can just click on it. It'll take you right to the page where you can see everything written out that I had in this presentation for you. All right, I want to thank you for your time. I hope you found this information useful, and have a great day.